Good morning, guys. I hope we're all sparkly. What should we talk about today? Why do I do my video logs in my car? Well, it started off like this, seems to work, so I've continued. If it ain't broke, don't fix it. But it's become a topic of conversation. I suppose the acoustics are good. I'm too busy to do them in clinic, outside of clinic. So it's a little bit of peace and quiet to collect my thoughts and to hopefully give you guys a sense of perspective that is pretty much lost when it comes to testosterone deficiency and TRT. Why? Most doctors haven't got a clue. They might read the guidelines, think they understand the topic. No, not really. You might be lucky enough to be referred to an endocrinologist who really hasn't got a clue. Well, you must have a testosterone of less than 8 to even be considered for TRT. But if you haven't got an organic pathology, we're going to let you live with that total testosterone of less than 8. Now, let's not even take into consideration free testosterone. We don't need that. Let's not measure estradiol. That's a female sex hormone. For, honestly, scary times. So you go to the doctors, you get no support, no hope, so you turn to the internet, where there is a multitude of information, most of it wrong, but there's a lot of hope, because these muscly guys telling you how wonderful they feel, they got this ripped physique through chicken and rice. You too could be ripped just like me. Just take this, do that, you'll be golden. Ain't like that, is it? You got to put the hard work in. Now, one of the commonest things with low testosterone is people get disheartened. Now, we're not going to go into why you have low mood, anxiety, depersonalization, but this disheartened feeling normally comes as a result of putting the effort in and not achieving the reward. That is disheartening. I'm running, I'm training, I'm eating right, I'm trying to sleep right, and I'm putting weight on, losing lean body mass. It's not good, is it? So what should you expect from normalizing your Melandra levels? Should you achieve this ripped physique? Well, you can if you put the effort in, day out, week in, week out, month in, month out. You sleep right, you reduce stress, you eat right. It takes effort. Any reward that's sustainable and actually worth it takes effort. So hopefully with testosterone replacement therapy, with normal male androgen levels, you can achieve your genetic potential. And as we've discussed before, you can slightly surpass it because you don't have that necessary balance of catabolic versus anabolic distorted by excess catabolic exercise. But as we say in this clinic, day in, day out, it's all about balance, baby. So, what should you be aspiring to be? You should be aspiring to be yourself. So hopefully these video logs give you a sense of perspective. I'm not telling you what to do. Hell, I'm trying to work it out myself. But what I do appreciate is the need for balance, effort to achieve reward, consistency, perseverance. One of my guys said, why don't you just tell us what it's like to be on TRT without training, eating right, sleeping right? Alright, what's the point? Because essentially melandrin levels are there to help anabolic processes to repair from the day. So you have to do something in the day in order to repair and to prepare for tomorrow, so that you can go ahead and seize the day. Carpe diem. We are designed to be physically active. One of my guys said, I don't like training. Are you depressed? Yes. Train. But I don't like training. Are you depressed? It's a circular discussion. Now, do I enjoy exercise? Well, I do. Is it fun? I find it fun. But when you start exercising, is it fun? Not really, it's hard. But that's what's fun. It's the reward you achieve going through that challenge, going through that struggle with the knowledge that you are going to feel better afterwards. I've never felt worse after training. Now, you can obviously break it down chemically. Endorphins, these opiate-like kind of chemicals that give you the euphoria that we're desperately seeking. But it should always be about moving forwards. The happiest people I know are the most productive people I know. They are the most active people I know. Depression comes as a result of unresolved physiology, and your physiology wants you to be active. One of the major distortions in our society is obviously psychological stress, not recognizing that we're physiological beings or physical beings. So you build up the cortisol and adrenaline, all these things that we should be using to be active, but we build them up because of psychological stress. The distortion is real. Mental health. Animals don't have time to have mental health issues. They're too busy surviving. But we're not. We're too busy eating to become chunky monkeys. Some of you love that term, some of you hate that term. What shall I call you? Lazy, ill-disciplined, all sorts of negative things I could say, but I like the term chunky monkey. I call myself a chunky monkey. So don't think for 1 second when I call you a chunky monkey, it's done with malice, spite, and evil intent to make you feel negative. Wow. That would be horrible. And hopefully, I think you're not, I think you think, you need, I don't know, geez, what do I know? Honestly, I get so confused sometimes. I literally do try to do my best and motivate you, inspire you to become a better version of yourself, much like I do to myself every day. I don't like waking up and doing HIIT in the morning, but I do. I do. It's all about moving forwards. So if you want to change and no longer be a chunky monkey and be a hunky monkey, you've got to put the effort in. Can you make mistakes? Of course. I make mistakes regularly. Should you give up? You should never give up. If at first you don't succeed, try again. Often the most successful people in this world have faced hardships. And you only don't overcome hardships by giving up. It doesn't mean you batter the same wall day in, day out. If you can't break through, you find another way. We adapt. So if you're not happy, get off your ass and do something. Exercise is the most powerful antidepressant out there. Exercise and nature will make you superhuman.